Welcome to Health Matters. I'm Dr. Derek De Silva. Many women across the Garden State are at risk of developing breast cancer in their lifetime. Although this is a very serious diagnosis, experts say early detection can make all the difference in your recovery efforts. Joining me today is Dr. Stacey Vitiello, a radiologist and breast imager at Montclair Breast Center. Having that Montclair word coming out there. What are some of the screening techniques? I guess mammogram. What else is out there?
Mammogram is the starting point for women, definitely by age 40, sometimes earlier if they're at high risk. And a mammogram determines if a woman has dense breast tissue. That's an extremely important thing for a woman to know if she has dense tissue or not, because then second-level screening tests are in order.
What are the second-level screening tests for women with dense breasts? Breast
ultrasound for the past 20 years we've been doing for our 40% of the women at our practice who have dense breasts. However, we've developed something new, Abbreviated Breast MRI, which is a game changer. This is a revolutionary approach to early detection that's only recently, within the past year, come to the forefront of screening efforts. Tell me a little bit about that, just very quickly. So it's an MRI. It's an
of
MRI.
The breast.
It's a 5-minute scan.
Okay.
It's 5 minutes on the table. It's significantly less expensive than a traditional breast MRI, and it is so sensitive for...
Better than an ultrasound?
Oh, head and shoulders above.
Okay. So a woman that has dense breasts, does she automatically get that test? How does that work? What's the situation?
Well, at Montclair Breast Center, we've traditionally offered breast ultrasound for anyone with dense breasts, which is good. It's better than the mammogram alone. However, MRI completely revolutionizes our ability to detect cancer
early breast
cancer,
etc.
So now it's offered. You know, everyone has their own threshold of how much screening they want to have.
Right.
So it's really a very individualized approach.
You said before that, and very quickly on this, if you have a risk for breast cancer, you should start the mammograms before the age of 40. At what point do you start that?
It depends. You know, it depends on what your risk is. If it was that you had radiation to your chest as a child, or that your mother had breast cancer at 45, you know, it's, again,
it's up to the kind of
cookie-cutter approach to screening.
Okay.
We individualize everyone's approach.
Thank you very much. Great information. Pleasure to have you here. Folks, here's a look at what's coming up tomorrow. Remember, you can catch Health Matters every Saturday and Sunday during our morning and afternoon newscasts. Thank you so much for joining us here today. Here's a look at this week's Community Health Calendar.